Hi everyone, welcome to our April Town Hall. We're a little bit late, we're in May, I realise that, but it is for good reason. We've got a couple of things that we wanted to kind of add to this, which it made sense to delay it. Plus, it did get slightly busy towards the end of April, so yeah. But anyway, here we are. We're going to kick off very quickly because we've got quite a packed agenda. So as you guys all know, you can ask questions in the Q&A on the top right. We're going to record it as well, so it'll go up if anyone can't join. But obviously, if there's anyone around who we think wants to join, just send them the link. I can see we've got a few people with us already, so hopefully the link is working and everything is all right at the moment. Cool. I'm going to kick off with our agenda. So we've got a few things on the agenda today, but they're not going to be super long. I've kind of shortened the COVID vaccination update, and everything else is only a few slides, so it shouldn't actually be too long a town hall, but we will just whiz through it. All right, so we're going to start with the COVID vaccination update, as we all know and love. So nationally, we're now at 35 million doses, which is pretty incredible. I think something like 50 million if you include all the second doses. To be honest, it looks like the first dose numbers aren't going up hugely quickly, which is to be expected. It's you know, the plan really, because there's a lot of second doses now coming through. But yeah, it's an incredible achievement, and obviously we've done our little part in that, which is great. In terms of supply, vaccine supply has been variable. I think it's something we anticipated last month. I was looking at the slide last month, and we mentioned this. You know, there is I think has been a bit of a drying up of AstraZeneca. There is actually a bit more Pfizer coming through apparently next week. This is all in terms of first doses. In terms of second dose supply, that should all be guaranteed. So I think when they procure first dose supply, I think they look at, you know, they basically reserve second dose supply for 12 weeks after that. So second dose supply is still coming through. So there are still a lot of clinics, but it's just that the first dose is not necessarily coming through in huge numbers at the moment. It's still Pfizer and AstraZeneca, obviously. Moderna, which was approved probably about a month and a bit ago, is now available in. I've heard rumours that it's available in parts of London, but it's in very low quantities. We've not seen any of it in our boroughs or in our hubs, so I'm not really sure that it's a kind of main player at the moment. It may change, but for the moment, it's really AstraZeneca and Pfizer. Obviously, there's this issue around over the under 30s and AstraZeneca, and the kind of eligibility has changed. I know that pregnant women can now get the vaccine, but I believe that's only the Pfizer. So, you know, if you are having any questions, if you do have any doubts, just jump into that chat. The COVID vaccination recall chat, and you know, you can ask all your questions there. So it's a very good place, and hopefully some of the questions might be answered. So if you know, have a read through that, you might find some answers to any of your concerns or questions. Yeah, in terms of who's eligible, we're now looking at anyone who's over 40 actually. So it's dropped all the way down to over 40s. And obviously that includes anyone who's of any age with sort of underlying health conditions that qualify, anyone who's a carer, anyone who's a healthcare worker. So same as before, but the age bracket has now dropped to under 40s, and you know, it's dropping down in little bits. So technically cohort 10 is 40 to 49. Cohort 11 is 30 to 39, and cohort 12 is anyone below 30 and above 18. But I think the government is taking a sort of staged approach. So within the cohorts, I think it went to like 45 and then maybe 42 and then now 40. So they're kind of dropping it down slowly, which, you know, well, it's out of our control, and there's nothing we can really do about it. But it just means, I think, that we open up to more and more patients, and hopefully more and more people can get vaccinated and fill up the clinics. Yeah, in terms of us and what we've been doing with regards to the vaccination campaign, you know, in terms of staff vaccinations, hopefully most people have now had their second dose and should be at least 2 weeks after their second dose. So really should be fully immunized as far as we can get it. If you haven't had your second dose, or you're still waiting for a second dose, let me know, or let Teresa know actually. And similarly, if you haven't had your first dose, then let us know if you want it. We have actually had people I know, even in head office, who've had their vaccine in the last a couple of weeks. So people are still getting it as they feel more comfortable. There's absolutely no problem with kind of, you know, coming and getting the vaccine now. Better late than never, for sure. So let us know, or to be honest, it's just as easy, rather than letting us know, just book in with your reception team. They should just be able to book you straight into the hubs. With regard to kind of our participation in vaccination and obviously the recalling workload, this is something that we've been working on over the last few weeks and months, because very aware that business as usual, you know, quote unquote, is going to be coming back, and in fact, technically, I think from 1st April, really, we should really be starting to get back into business as usual, whether that means seeing patients, whether that means, you know, looking at other targets. I think all of the schemes, the various QOF and national, local schemes will be coming back this year. So we really need to kind of take that into consideration, and we need to take into consideration our clinical capacity. To help with that, I think I mentioned this last month, and I think some of you may have kind of come across them. We've got these non-clinical vaccinators. So we've hired 13 non-clinical vaccinators who have joined us on a 0 hours basis. They are actually employees of ours, and they are actually really doing some heavy lifting on the vaccinating. So they have done, between them, I think at the moment in Roche Cloud, I saw we've got over 600 hours covered by them, which is split over 110 shifts, which is pretty phenomenal. And that's including some in the future. I think the Artesian plan's quite far in advance, but that's kind of the total number that they're currently doing. I expect that to go up. We may actually also bring on more vaccinators. We're just having a chat and seeing whether we can kind of facilitate more of these non-clinical vaccinators to have shifts. The other thing there is that we are potentially looking at, because the non-clinical vaccinators have been such a you know, great success, we may look at supplying more of them to the hubs. So kind of moving the hub model from quite heavily clinical, which is where we were at the beginning, to much more heavily non-clinical. Now, there will still be a requirement for clinical supervision, of course. These non-clinical vaccinators can't just work independently. They do need a prescriber with them, or not with them, but kind of supervising. And so if people are still keen to do some extra hours, or you know, you find that there is an availability to do a shift, then please let Alex know, because we are always looking for people to do vaccinating, especially if you haven't done any. It's a really good opportunity to kind of do this before we move back to more business as usual work. The other thing I wanted to mention is that we've run our first vaccine van, which is pretty cool. So in Southwark, they've hired this. I should have put a picture actually, but they've hired this lovely van. I think they actually bought it, and they labelled it with COVID vaccination service. And it goes out to areas of the community where we feel there's been a real, you know, poor uptake, and it's about outreach. And you know, it's not the most efficient way of getting people vaccinated. Obviously, we're doing huge numbers through the hubs, but it's a way of getting those people who are maybe a bit reticent to come to the hubs, people who aren't sure, getting awareness out there, getting kind of education out there, and speaking to patients. And it's a really, really positive thing to be involved in. So we did our first one. It was a bit of a pilot. We didn't have a huge amount of patients coming to that. Charlie helped us with that. Charlie from Penrose helped us with that. And yeah, we're going to be hopefully doing more in the future. So if anyone again is keen to help lead one of those outreach sessions, let me know, let Greg know, and we will get you involved in the vaccine ban. It's pretty fun, so definitely worth something to consider. Yeah, and then I'm going to quickly hand over to Greg to kind of talk us through the next slide about recalls, if that's all right, Greg. I'll mute.
All right, hopefully everyone can hear me and everything. In terms of recalls, still ticking over really, really well from a lot of the teams. Numbers are dropping steadily. I know there's not a lot of clinics out there, and lots of people are struggling to find a clinic to book patients into, but there's not a lot we can really do about that, and all we can do is just keep calling where we can. Following on from what Sachin just said, second dose clinics are huge and there are loads of them. So if you do find yourself with a spare 10-15 minutes, calling second doses is really, really quick and easy. Quick wins all over the place. People might just not have a mobile number or just might have missed the text, and as I said, it's really, really easy to pick up the phone and call and get them booked in. Again, following on from what Sachin said about the bank vaccinators, we really want to start utilising them not only for the vaccinating process, but where we can and where we need to. And perhaps not at the moment, because as I said, the clinics are quite full. But perhaps in 1 or 2 weeks, when we get a few more clinics up, we can start using these bank vaccinators as recallers as well. So you guys can carry on with your normal workload, perhaps focus on different targets, housebounds, etc. And the recallers can come in and do some of the recalling for us. Alongside of that, I'm working quite hard on just creating a little cheat sheet, which is going to sit on our SharePoint, mainly for the bank vaccinators to learn how to do recalls. But I think also it would be quite useful for people to have and be able to refer to. Perhaps we can put on some FAQs on there, so they don't only sit on the chat. They can sit on that website. So instead of having to scroll through the chat and look through the answer to your particular query, you can just go straight to the SharePoint and find your answer. As always, thank you so much for your hard work when it comes to recalls. I know it's difficult, but I'm going to keep updating the spreadsheets on a weekly basis. So the second doses will increase, and the recall dashboards, I try and do one every 2 days, one every 3 days or so, just to let you guys know and so you can see the progress.
Do you want to just explain this dashboard quickly?
Yeah, so I'm not sure how many people have actually seen this one. Hopefully you guys are looking at it. So this is the second dose dashboard. It's quite hard to see from my screen, but on the left-hand side, you've got the actual status on EMIS. So at the bottom, you've got the ones that have had that. So this is all only showing the ones who have had their first dose. At the bottom, you've got ones who have had their first dose and they're not due at the moment for their second dose, so they haven't quite reached that 10-week threshold that we're referring to. Just above that, you've got the dark green, that's where it's complete. Above that, so that means they've completed their second and first dose. Above that, on the slightly lighter green, that's booked. Again, just referring to the AccuRx, if they've got an appointment upcoming, had their first, and they've got their second one upcoming. And then you've got your yellow and your red, which is your due and overdue. Due is your 10 to 12 week, I believe. And then red is anything over that 12-week mark. Looking at the left one, that red and yellow numbers, they'll add up to on the right-hand side, and these are the patients which are due/overdue and their status in the recall sheets. So very similar to the first slide that you would have seen for weeks now in regards to the first dose. On the right-hand side, you've got your status in the recall sheet. So red are the ones which are outstanding, not attempted. Your yellows and your greens are your booked according to the recall sheet / attempted / other comments. And then your grey is kind of this, it's normally the overlap between where a patient has gone from being overdue to due and they haven't been updated in the spreadsheet yet. So don't worry too much about the grey, really focus on just hammering those red, the ones that are due and the ones that are appearing in your recall sheet. And yeah, the grey will slowly will decrease at the start of the week and probably increase during the week. But as I said, not to worry about. Really want to focus on that red, the outstanding ones that you guys can call. I'll hand back over to Sachin, I think, for a couple more slides.
Perfect. Thanks, Greg. So yeah, I think that's really helpful, and hopefully everyone's kind of able to see those dashboards in the chat, and it's a kind of guide for us to make sure we're getting patients in. Let's pause and see if there are any questions in the chat. I don't think there are. Yes, so Andrea has given us a question, which is a really good one. Can non-clinical vaccinators from different boroughs vaccinate across different sites? Definitely, yeah. So our non-clinical vaccinators are effectively, the key thing is to make sure, we've had to make sure that they're signed off in all the different stages. So whether that's have they had experience sort of asking questions and consenting, have they had experience drawing up the vaccine, have they had experience actually administering, and then have they had experience and been signed off with the recording of the vaccine on Pinnacle. Now, once we're comfortable that they've been signed off, and typically we would get a sign-off sheet from Guy's or whatever other hospital they've done their training at, then we would basically deploy them to the field, and they can work in any of the boroughs. The only slight complication to that is that if any vaccinators are working in the artesian is always quite keen for them to be signed off at the artesian. So at the Waldron, they come in and they pretty much just crack on. At the artesian, their first session, they will need a little bit more supervision, so they can be signed off. But ultimately, it's pretty much the same, and they can work across different sites for sure. Great. So I think that's it for COVID. If anyone doesn't have any other questions, drop them in the chat. We will try and answer them a bit later. In fact, the next bit is Greg, so I'm gonna hand back over to Greg in just a second.
Hi everyone, back before I expected, but going to talk a little bit about surgery logs forthcoming across all 5 sites, and hopefully something that you guys are going to really like and enjoy. Surgery logs is essentially a tool which is going to replace Introdoc 247. As you guys know, Introdoc is where you guys record the your temperatures, so your fridge temperatures, your vaccines, your emergency drugs, all things like that, all like audity sort of based tasks that you guys do on a daily occurrence. So surgery logs, what is it and why are we introducing it? So Introdoc, as you guys know, is so slow, bloated, and it's just awfully presented and really outdated. We want to introduce surgery logs because it's going to move you guys over to just focusing on Teams, and you haven't got to worry about another login, another place to do it. And not only that, but it allows us more customization, more opportunity to dynamically change the logs that you use, and we hope you like it. We've piloted it at Kingfisher here with 6 logs at the moment, and we plan to build more where required and where desired. They've broadly enjoyed it. There are elements that need tweaking, and we're happy to do that. We have that ability with surgery logs, with MS Teams. We can change, chop and change, and make it better and better as weeks go on. Forthcoming, I said there's going to be more logs, and the rollout plan is coming. So starting off, the current surgery logs we have at the moment are temperature, cervical screening, emergency drugs log, meetings log, AMBP waiting list, and a vaccine spreadsheet. Now, the first 5 that I've just mentioned there all sit on a thing called MS lists, I believe, which is Microsoft's solution to just creating a list and having automations based on it. Sits entirely in Teams, so you can just go into your Teams channel, which is going to be, as you look on your Teams, it will say, you say the surgery name, and then below it will say a channel, and that channel will be called surgery logs. On there sits the 5 lists. What some benefits of it, and as you'll see on each log, you get email reminders, and we get conditional formatting, dynamic call to actions, basically everything we can't do on Introdoc, all the visibility that we lose on Introdoc, we now have back with surgery logs. Last one there, the vaccine spreadsheet. When we first introduced it, we realized that everyone was doing their own sort of thing, whether that be a Word document or a spreadsheet when they were recording how many vaccines were in the fridge. We just want to standardize that and put it all onto the same place with one simple to use spreadsheet. So it doesn't have to be sent to anyone. It could just sit there. No one else needs to get involved, just the HCA/nurse who's doing the audit monthly. Moving on to the next slide. Now, this is the rollout plan. It's a little bit ambitious, I will admit, but it's definitely achievable with us working together. So looking from the start of next week, I'm going to be creating the surgery logs channel. So you guys will see the logs, the surgery logs channel will appear in your Teams chat. This will, don't worry about it for the first week. I'm just going to be replicating what we've done at Kingfisher onto your specific sites. And then following that, once that's all done, we're going to try and confirm the availability for staff training and discussions to be held. I would love to come out to the sites, so I'm going to be speaking to the reception leads, nurses and HCAs to see if we can organise some sessions for me to come out. I love coming over, I love seeing it. And then on top of that, we're also going to have online training sessions as well, which will probably be all 5 sites wide. And that will take us up to around about the 24th of May. So 2 weeks to get that all done. A lot of work and a lot of organising to do, but as I said, really, really achievable if we work together. From the 24th of May, I would like all 5 sites to be using the surgery logs, in particular the temperature one, cervical screening, and the emergency drug log. It'll take a little bit of run-up time, and that's fine. We can discuss, and there's lots of iterations which are going to improve on it. And then the deadline and the date that we really want to just completely stop Introdoc, export all the data we have on it, and completely use surgery logs is going to be around about the 11th to 7th of June, the start of that week. We officially have access to Introdoc until the 11th of July, but we want to be moving all of our processes onto surgery logs as soon as possible. I'm not sure how best to do this, but I just quickly want to show you what it looks like in Teams to give you guys an idea for the next forthcoming weeks.
Should I do it on my side?
Yeah, I'll do it on your screen if I was you searching. So you should go to Teams. Obviously, Sachin's one is massive with everyone's channel on there. But if he just goes down and finds Kingfisher, and then just below Kingfisher, there's surgery logs, and you're introduced to, just as you would a chat, normal chat. At the top, you've got all your tabs. As reception will know, this is where the COVID recalls normally sit. When in this case, it's going to be an MS list. Going on first is the temperature log, probably the most used one, daily occurrence, based on each fridge. Give it a chance to load. And here you go, you can see the Kingfisher team entering the surgery logs for each vaccine fridge that we have for about, I want to say just over a month now, maybe a little bit less than that actually. Something we're going to work together on, dynamic call to actions on the right hand side, and daily email reminders as well, which I know the team are a little bit annoyed at, but it is really, really useful to just to prompt you guys for these daily tasks that normally sometimes get forgotten. Sachin's actually just gone on to create a new list item there. Really, really simple. It's just like Introdoc, it's just in a better place, more user friendly, and one less thing to worry about.
Do you want to go through all of them, or?
No, I won't go through all of them. I'll prefer to go through them individually, site by site. I think these lists, once you actually get hands-on, you realize how easy they are and how useful they can be. The automations that we can do with MS lists and Power Automate are amazing. So if anyone has any ideas or what they want to use this for, please get in touch. We can organize some training at sites not just for surgery logs, but for other audits and tasks that we need to do. So please reach out, get in touch, and I will be also reaching out to reception leads, nurses and HCAs to organise the training as soon as possible.
Awesome, thanks Greg. I am going to hand actually over to Karan next, who is going to take us through some operational updates.
Okay, hi, thank you. Hello everyone.
Karan, you with us?
Yes, I'm with you. Can you hear me?
We can hear you, that's all good.
Okay, I think there's a lag.
I think it's all good, it's just I was on, my speakers were on mute.
So this is something which, following up from last month's town hall, we mentioned that we were looking into incoming patient letters and how they are processed at each site. So there's been some good progress. We've gathered feedback from all the GPs, and Dr. Hawkswell, Dr. Brody and Priya have also been auditing all incoming letters at one of our sites and found that even 2/3 of the letter that were going to the doctors after filtration didn't need to go to doctor. So there's a bit of work to be done there, which prompted us to rethink the whole process and redefine the protocol. So it's been reformed now, and it'll be signed off probably end of today or tomorrow, and then Priya will be in touch with all clinical admin team members about the training on the new protocol. Now, in the new protocol, we've categorized the incoming letters 8 key categories, and they have over 56 subcategories. And out of those 55 categories, around 24 categories would normally go to the doctors. Other categories are then divided between the pharmacist. There are a couple of categories of letters which will end up on mental health workload. By categories here, I mean the types of letters. I'm not talking volumes. The volumes will depend on day to day and site by site. There'll be some letters like ECGs will be going to the paramedics. So all our clinical team members will need some training on this. Even though you've been actioning these letters in the past, we've basically laid it out nice and clear, so you know what the expectations are, and if you need any training, we can provide that. So this is all going to happen in the next few days. We can, that's all I have to say on this topic. If we can go to the next one. So again, I think this one we mentioned a month or 2 months ago about remote monitoring of the fridge temperature. We've had issues at Nightsill and also sometimes at other sites where the fridge door is left open, or there's a power cut, or there's something wrong with the fridge condenser, and we find out too late. In the last 4 or 5 years, we've had 5 episodes, I think, where we had to discard all the vaccines, and lots of appointments, lots of valuable vaccines were wasted. So we've been looking to avoid what are the options to avoid. So we learned from local pharmacies like Boots, and there are a few pharmacies in Luton what they've been doing. Waitrose, John Lewis, they also have a temperature monitoring system for their freezers and fridges. And we've been testing few solutions here at the head office. Now the solution we've selected is called Cold Chain by Denver. So Denver provides this system to a lot of local pharmacists in the Luton, so it came very highly recommended. And it's very simple. You will see that there are, we're going to roll it out at Kingfisher this week. The order has been placed for Kingfisher, and I got my logins today, and I can see where our sensors are and how much the temperature is in the transit van. Actually, they're still live. Don't know how they're working, but so the sensors sit in the fridge, they talk to a gateway device which connects to the Wi-Fi or cable to the router, and then talks to the internet. And we then go to a website and see the temperature live, or we have an app on our smartphone and see the temperature there. And then we can set alarms if the temperature goes above or below the optimum range. We can set alarms. It will send us the app will send a notification. or if there's a power cut, or if there's internet connectivity issue, we get alarms on that. So this is being rolled out at Kingfisher next week, and then will be scaled to other sites within next 30 days. Next slide, please. That's all for now, I think. Charlie's next.
Thanks, Karan. I'm actually going to do the Penrose, what I'm calling the Penrose Cupdate, in a clever play on words that I have decided on unilaterally. It may have been quite late when I was doing these slides as well. But yeah, so just a very brief update on the Penrose Cup and where we are. So there you go, all our teams, very exciting. Obviously, this month we had the Bake Off. Well, last month technically. It was amazing. As someone who was able to eat every single one of the entries, I can assure you guys that they were all amazing. I was actually, I would say it was probably about like 30-40% better than last year, and last year was pretty good. So we had a total of 31 entries over the 5 sites. I think I really like this statistic. So with 3 judges judging and 10, like judging out of 10 in 3 categories, the 31 entries generated a total of 2,200 points, which is pretty awesome. That number would be a lot lower if the cakes were worse. I mean, the average was 8 out of 10. So yeah, very, very, you know, happy to eat all of those cakes. And it's a tough job. It's a tough life. And we had to, unfortunately, we had to pick some winners. I say unfortunately, but you know, it was quite tough to kind of pick our favourites, and the scoring system really helped us, obviously. So I just kind of briefly go through the winners, but obviously you guys all know, and it's been posted before. So at Kingfisher we had the COVID life cake by Katrina, which was amazing. It was, I don't know if you guys have seen the pictures in Charlie's emails, but it was just a ridiculous looking cake. The icing work was awesome. Deptford, we had the honey and rosemary cake from Rachel, which was also absolutely delicious. That ended up being the overall winner, actually. So well done to Rachel. Nines Hill, we had a fruit nut cake, which was pretty yum. I remember that was very good. And I think even Eddie had a little bit of that, Eddie the dog. So yeah, we all enjoyed that. Penrose was really tough, and the presentation at Penrose was very, very good. So well done to the team for me. I don't know if you guys have seen the picture of the Penrose logo made out of strawberries. That was pretty cool. I wanted to give that the winning prize, but that was deemed not baked, so I couldn't. But actually Priel was a very deserving winner. Really yum cupcakes, and actually they had little macarons on top, which were homemade as well, which was amazing. And then another salted caramel winner at Lewisham Medical Centre. So Alexandra made that, which was really, really lovely. So you guys are all going to get a custom apron. I'm still in the process of making that, so bear with me, but we will get you a lovely apron for your hard work. And yeah, well done to Rachel, who was the kind of overall winner across the group. I still haven't heard from you, Rachel, regarding your meal kit. Let me know what you want to do. And then yeah, the runner-up was actually Charlie, who made a delicious Thai pineapple. Again, I don't know if you guys have seen the pictures, but it was pretty amazing. It was like a half pineapple with filling in it. So I hope you guys have had lunch, because I'm now feeling quite hungry. Oh, I'm not going to do the video because we've and then yeah, in terms of the leaderboard, funnily enough, actually the scores were exactly the same as the last challenge. I promise that wasn't like planned. We just basically did it based on sort of scoring in the spreadsheet. So Kingfisher, we've got a bit of a way to go, but there's still plenty of time, and the Christmas Spirit challenge is double points, so we can definitely make a comeback. We have to kind of show everyone what's what, but also well done to everyone for kind of participating. The next one I think Charlie has actually announced it. I think it's going to be a quiz, but I just thought I'd put some emojis there. So study up, be ready, Kingfish team especially. And I'm going to hand quickly back over to Karan, who is going to talk us through the bike ride.
Hello again. We got the slide up, Sachin. Thank you. There it is. So we've been talking about having a bike ride last year, obviously because of COVID. Lots of us took on cycling, and lots of our colleagues have been trying to get together outside working hours to go for a ride. But because of lockdown and workload, we weren't able to plan that so far. But now we've got a date in diary. I put a little poll last week and had good response. I know more than 16 people replied now. I think there's gone up. Everyone can do the 22nd of May, which actually works better because after 17th of May, the lockdown rules relax further and the weather hopefully will be slightly better. So we've selected the shortest and the least hilly route, the easiest route, which I'm quite happy with because we got cyclists from various different background and experience. So it should hopefully be a fun ride for everyone and a safe one. I will post something else in the group about preparation, but basically we want you to start on time. So starting from Bromley South, please be there at 10 o'clock. If you're late, you might be left behind and then you'll have to find us using your GPS and pedal fast. Bring your helmets, please. There's not going to be any ride without a helmet. We won't be allowed to. If you don't have a helmet, I've got plenty of spare ones, 3, 4 I can lend to people. Just let me know. Make sure your bike is in good working condition. Bring water. I don't know how hot it will be, but we lose a lot of sweat when you're cycling, endurance exercise, so don't underestimate that, and it can lead to cramps. So please bring water with some electrolytes and get some nutritional bars or bananas or some sort of carbs that you might need. Make sure your mobile is charged because you'll be out for most of the day. And bring a little puncture kit. Most of our cyclists have a little saddle bag where we put all the puncture repair kits. And I would highly recommend using padded shorts or bib shorts. 40 kilometers is, it may not hurt your backside while riding, but you will feel it next day if you're not using padded shorts. And lastly, I know we've got some parents who showed interest, and we would love them to join, but sadly, because of the traffic, I wouldn't suggest that we have anyone under the age of 18 to join. And there'll be a small waiver form for everyone to sign because this is out of work activities, voluntary, and I want everyone to be aware that this is, they need to be responsible for their ride and road safety and stuff. So also there'll be, we'll send more reminders, and I'll share the link of the map. So it's on Google Maps, but you can't click on it here. So I'll send it separately. Thank you.
Awesome, thanks, Karan. Cool. So yeah, it's very exciting. I'm keen. I'm coming. So I'm keen. I've just bought my saddle shorts actually just now. So yes, I have suffered from the issue that Karan is referring to. I'm aware. I would highly recommend others do the same. That's enough talk of bums. In terms of referrals, we have a new referrals program, or it's not a new referrals program, it's really an update to our existing referrals program. So we kind of have had one for a while, but I don't think it's ever really been properly publicized, or it's never really gotten into a proper, full swing. And I think now that we've really upgraded a lot of our hiring and we're using our system in it, and we've got a lot of hires actually happening at the moment, we thought it's a good time to kind of relaunch the referrals program. And I think obviously there's a financial component to it. You'll see on the next slide. There is obviously a bit of a reward, but really the kind of ultimate reward, which I think is quite good for everyone, is that if we can hire great candidates, and the referrals program is designed to try and get us the best hires, or at least help us to get there, then that's going to reward all of us. And hopefully, if we have great colleagues, we can have a great workplace and provide the best healthcare to patients. So this is a really quite an important thing. I personally feel very strongly that we need to have a good system for kind of getting good candidates, and so this is going to hopefully help us with that. The first step, and you'll see another one of our snazzy GIFs on the right. It's a bit blurry, but it should give you the idea. Basically, this whole thing is tracked by a greenhouse, and the whole system the whole hiring system is done through Greenhouse, which is this online app, which you've all got accounts for. You should all have an account for. The thing I will say is that you will need to activate your account. So I've put a little GIF there on the right, which just talks you through it. But basically, you go to the website, which I've put the link there, app4.greenhouse.io. You put in your nhs.net email address. Now it looks like you're logging in, but obviously you don't have a login because you've never been on the website before, most of you. So on the next, when you actually click through there, and you can see on the GIF right now, you're going to want to click forgot your password. Now once you've clicked forgot your password, then it'll ask you to re-enter your email address, and then it's going to send you an email like you'd normally expect from a forgotten password thingy, and you just go, once you click on that email, it will then say, hey, you want to activate your account, please click on this link. So that's the best way to do that. I can try and kind of walk you through it if you're not sure, but it's hopefully quite simple. And in order to kind of participate in any of the referral stuff, we do need to get you activated on Greenhouse, otherwise we won't be able to track which candidates are coming from you, etc. In terms of the program itself, so it's split into two. And the one on the left is the kind of traditional one. The one on the right is a slightly newer thing that we're adding. So on the left, it's basically referring someone you know. So you might have a friend who's working as a nurse or whatever, and we're currently looking for a nurse who's not happy with where they are, or they've just left where they are, and you know that they'd be a great fit, and you want to refer them. So if you want to refer them, you're going to come to it's a Greenhouse, and there's actually a referral box on Greenhouse. So you'll see once you're activated, once you're in on your homepage, there's a big box there which talks about referrals, and you can either add their CV, or you can and you can kind of fill in their information for them, or you can actually generate a link which you give to them, and they can fill it in, and we know because they've applied via your link, we know that they come from you. Now, obviously, they're still going to go through the full process in terms of recruitment. So there's no guarantee they'll get hired. And obviously, we do have to kind of be fair to candidates who apply from different sources. But it is good to know that you've spoken to them. It's kind of like a reference, and you can kind of vouch for them. And the good news here is that if we do hire a candidate who you've referred, and if they pass their probation, then you get £200, which is pretty cool. It's good, decent little bonus for not having to do a huge amount. So yeah, it's a really nice little system. Obviously, we can't guarantee that we're going to hire the person, but it really does give us a good, certainly for a lot of the clinical roles where we maybe don't get a ton of applicants. There's a good chance that we may well look at the candidate with with a view to hiring. So that's kind of one half. And then on the right hand side, we've got this slightly new half. Now, this is really enabled because we've now got a new careers page, and I think I showed you guys a couple of months ago, our new careers page. You can just go to penrosehealth.co.uk/careers, and you'll find the page. But basically, we're really keen now to get the ads that we post out in front of more people. So what we've done is we've sort of set up a two-part program here. Now, you're not necessarily vouching for these people, and this isn't the same as referring someone you know. This is just a case of kind of amplifying the reach, because obviously we post ads on NHS Jobs, on Indeed, on LinkedIn, whatever it might be, but we don't have the ability to kind of post in certain groups, or we can't necessarily reach as many people as we could if you guys repost us. So what we've done is we've kind of set up a system where if you repost our ads, we will give you £10 per advert that is reposted. And if anyone who comes through that advert, and we can see that, we can track who comes through your adverts because we give you a specific link, that we will pay £100. So basically, you know, it's not as much as if you refer someone who's hired, so because that's a slightly different process. That's like you've spoken to them, they think they'd be a good fit for the job, and you know you're vouching for that person to a certain extent. This is a little bit more. This is much less involved, so you're just going to be posting it and hoping that people click on the ad. But it is still a nice little incentive to try and get it in front of the right people. So in order to try and kind of get this ad out there, to the mechanics of this is slightly different to the referring someone you know, where you're just going to go to Greenhouse directly and that's fine. With this one, just let me know if you're happy or keen to post some of the posts, and I will send you a link. And actually, you'll get a specific link for each place that you're going to post it, so that we can track where the candidates are coming from and we can track who is the source. If you just repost the advert that is currently online, it won't work, and we won't be able to see which candidate's coming from you, and we won't obviously be able to kind of reward you with the system we've got here. So you do have to come through me, and you just let me know, and I'll give you the links. Just send me a Teams message, and I can drop you any links. You can say, hey, I'm planning to post here, 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 here. You know, can you give me 4 links or whatever it might be? The places where we've been finding really quite a lot of traction have been a lot of the Facebook groups. Now, obviously, when it comes to Facebook groups, I think we've got to be a little bit careful. We don't want to, if you're in the same Facebook group as like 5 other people and they all post the same ad, I think it could look a little bit odd. So I'm going to kind of manage that process, and that's part of the reason why you're going to come through me in terms of getting the links. But essentially, you know, we want it kind of posted in as many networks and in front of as many eyeballs as we can. So, you know, it's a nice little, again, nice little bonus. You don't have to do a huge amount, and you can earn up to sort of 50, 60 quid potentially if you post it in a few different places. And then you just send me a screenshot when it's posted. So that's it. Cool little program. I don't know if anyone's gonna you know, take me up on that. I hope you do. It's a really, I think it'll be a good way for us all to get some exciting new colleagues. Yeah, I'm gonna just kind of crack on. So, general update. We're just going to quickly go through this one. I think we're pretty much at the end of time. We've done really well for time, so hopefully everyone's still with me. I can see we've got quite a lot of people in the chat. So, starters and leavers. Quite a nice little picture this month. So we've got 3 new starters. We've got Abigail, who's a new receptionist at LMC. We've got Subu, who's clinical admin, who's working predominantly on the Penrose clinical admin, but I think he's actually based here at Kingfisher because of space. And we've also got Anjali, who is our new pharmacist at LMC. So hopefully you guys have all met these guys and making them feel welcome already, but I'll just kind of welcome them here on the town hall. We also have 13 bank vaccinators. So I mentioned them earlier. That was a kind of big hiring process for us, and it's really interesting because it was an opportunity for us to test the robustness of our hiring and our onboarding, and you know, we were able to hire and onboard pretty swiftly and not take a huge amount of time out of our week. But they are now, with us, and they're on payroll, and you'll see them on Bamboo if you look for them. And they're kind of doing a lot of those vaccination schemes. So kind of 3 to 16 new hires, depending on how you look at it. And then we've got 1 promotion. In fact, last month I think we also had a promotion with Rafe. But this month I've separated out. Gary is I think hopefully most of you guys know Gary by now. He's been with us I think for a while, and he has been we've given him the title of lead paramedic, so he's going to be leading the paramedic team across the group, and hopefully you guys all know him, and you'll get to know him. He's really awesome, and he's hopefully going to do a great job in terms of managing that team and hopefully managing the function and making sure that very critical function for us now is running as smoothly as possible. In terms of leavers, we've actually had no leavers who have kind of been permanent employee, as in post-probation employees. So that's good news. And then in terms of hiring, we are hiring a lot of people. So we are looking for a pharmacy dispenser. So I think our original pharmacy dispenser had left within probation. In fact, with most of these, they left within probation. We've got a nurse who we're looking to hire at Knights Hill or Penrose, so possibly one or the other. We're looking for a GP at LMC. We're also looking for relief GPs across the group. So if anyone knows a GP who's maybe looking to kind of have the flexibility of a locum, but also a bit more of the benefits of a salaried GP and a bit more of the certainty, then that's something that I think we're really keen to have. Someone who's kind of on staff to cover holidays and sick leave, etc., etc. You know, really important role for us as we grow and expand as a group. COVID bank vaccinators, obviously we were looking, we've kind of paused that process at the moment because we've got a lot of people in the pipeline. To be honest, GP and pharmacy dispenser is also paused because we're in the final stages. But nurse and receptionist and relief GP, if you guys know anyone, please, you know, take advantage of that referral program. Please share the ads. The more eyeballs we can get this in front of, the better we can do in terms of hiring. And then we're still looking for a couple of people centrally. I'm hoping that we can kind of finalize that in the next week or so. But yeah, we want to get the right people so that we can really do more stuff and do great things. So that's it in terms of starters and leavers. Other things that have happened this month. We've talked a lot about a lot of stuff already. It was a bit of a whirlwind, but there's more stuff. There's always more stuff. We are, in terms of hiring, still my favorite topic. We've been accessing some new routes for hiring. So we've got some new job boards. We're looking at some graduates. We've been going to different sources. There's Track Jobs, which is now an advertising board we've been using, predominantly more of a hot ad advertising board. But yeah, it's kind of all about getting, there's a theme here, about getting really great applicants and hopefully hires. We've been looking at new routes to help with vaccination programs. So whether that's locally, I think I touched on it earlier, possibly expanding our kind of coverage of the local vaccination hubs with our non-clinical vaccinators, and possibly also in other CCGs. I think it's kind of a problem that is throughout London, and if we can build up a really good, reliable bank, we may be looking to help there, but still in kind of the early stages, exploratory there. We've been engaging with Clinical Effectiveness Southwark a bit. So Clinical Effectiveness Southwark, I don't know if any of you guys know, but they are a Southwark entity who are now going to become an SEL-wide entity. They're really quite good. They're a team of doctors who create really nice templates and basically help practices to achieve their targets. So we've been working with them, and hopefully we'll do some pilot work with them at Penrose and maybe roll out some more improvements across the group based on that work. We have been exploring the possibility of COVID vaccine videos. I think I mentioned this to some of the GPs, the lead GPs last month, but we are possibly looking at, I don't know if you guys have seen on our websites, we've got an FAQ section. And we might look at, if any of you guys are keen, I'm looking for sort of potential TV stars, anyone who's happy to kind of go on YouTube. I'm not sure we're going to get tons of views, so I wouldn't be too worried about going viral or anything, but it's just to kind of help our patients engage with the COVID vaccine. You know, it's sometimes, I think, difficult for people to read through everything. It's more engaging if we do it in a video format, so we're looking at doing that. Also in conjunction with the hubs potentially as well. So if anyone's keen, just let me know, and we can possibly get you involved in that. We've been refining our leads framework, so you can see obviously we've got Gary involved, and we're just kind of looking at that as a framework across the group. The Mornington Surgery business case, and this is kind of public knowledge as of yesterday because the PCCCs are all public forums. It's now been approved, so we're totally signed off, and actually I think we've got a mobilisation meeting tomorrow So that's kind of all going ahead. I think we talked about that a couple of months ago, kind of merging with Mornington Surgery. Basically, their patients will be coming over to here at Kingfisher, making Kingfisher quite a big site. So Kingfisher's, I think, at 9,000 patients at the moment, just shy, and it'll probably move up to almost 13, I think, with the addition of Mornington, depending on how big their list is at the time. Complaints, we've got a new framework. You guys won't see anything on your end, but what we've done is in our project management system here in head office, we've really rebuilt the complaints project. So we're able to more accurately track and understand trends and look at what's going wrong, more objectively, rather than I've seen 2 or 3 complaints about this, and trying to really understand and analyze the causes and the trends. So that's hopefully going to yield some improvements over time. We're doing a similar thing with significant events, where we're trying to move from a bit more of a ad hoc process to a much more thorough and sort of analytical process, where we can really analyze the data afterwards and look at trends. So hopefully you'll see some of the outputs of that, and Julie may talk a little bit about that next month if we get to that point. So you'll see some of the outputs and some of the data that we generate. It's really quite interesting, and hopefully will give us something to kind of think about. We've been progressing our EMIS tidy up projects. Very slow, very painful, but we do have to tidy up EMIS across the group. It's not ideal, but we need to get there. And the operational data stuff. So I know Greg and Karan have been working on this a lot. I've said more dashboards, not necessarily dashboards that everyone is going to see, but it's dashboards we use internally to understand what's going on in a quantitative way, and hopefully it'll help us again to provide better care. We can identify pain points or bottlenecks before they become acute, and that's really important to the smooth running of the business. So yeah, that's it. We made it almost exactly an hour, actually, 1 o'clock, 59 minutes on the clock. So next town hall will obviously be in the end of this month. I'm going to try and stick to the date this time, 28th of May. Not a huge amount of time later, not a huge amount of time between them, but hopefully we might have some fun stuff to talk about there if we get to it. And then yeah, let us know if there's anything you want to hear. But otherwise, I think just thank you guys for attending, and thank everyone for their hard work. I don't know if Dad's kind of come off mute if he wants to say something.
No, not to say thank you for all your help, and thank you for everyone across the group for all their continued hard work during the pandemic. You've all been absolutely amazing, and thank you to Sachin really and Karan for putting together the town halls, which are very informative. So do tell colleagues about it. Do ask them to go back. It is recorded. It's a good source of information. I think it's very in 1 hour. That's a lot of very succinctly put together stuff. Also, feel free to look at the Kingfisher Mornington business case. It is a public document. It's available on the PCC minutes. If you want to know where it is, just let us know. Thank you all.
Thanks, guys.